Are you trying to figure out the cause of your dizziness and vertigo? Maybe you've even had a VNG test ordered by your doctor, and perhaps it didn't really show anything significant, and therefore your doctor concluded that you cannot possibly have BPPV, that's benign paroxysmal positional vertigo, because your VNG test was normal. Has that happened to you? I've heard from a number of patients that have experienced that, and so I've written a blog on this topic, and I'm going to address that important question in today's video. But first, I am the Vertigo Detective, Dr. Kim Bell, a licensed physical therapist in San Diego, California, and I specialize in helping people with dizziness or vertigo get their life back. This video is offered for education, information, and hope for patients I cannot work with in person around the world, but this is not individual medical advice. Be sure to talk to your own doctor to get individual advice. Some patients get a VNG, some patients never get a VNG. So if you've never had a VNG, then maybe this isn't a relevant topic. But if you had a VNG and it was normal, and therefore you were told there's no possible way you can have BPPV, but yet you do have dizziness when you lie down in your bed, roll over in bed, or get up out of bed, or you have dizziness when you look up, bend over, or turn your head quickly, then this information is for you. Now let's take a look at the blog that I wrote on this topic. This was inspired by patients I've talked to that have actually gone through this exact experience. So the question here that I'm answering in this blog is it possible to have BPPV, those are the ear crystals loose in your ear, with a normal VNG test? Typically, BPPV is going to show up on a VNG test because most testing protocols include BPPV testing as a standard aspect of the VNG. However, there are, in my mind, two scenarios where you may have BPPV even if you had a normal VNG test, and that's what I cover in this blog. You can find this article yourself if you want to go to my website, vertigodetective.com, and then type in the search bar the letters V as in Victor, N as in Nancy, and G as in George. So VNG. If you type that into the search, you can pull this article up yourself. But I know there's a lot of you, like my husband, who will never read an article ever. And that's why I'm covering this in this video for you. Many doctors today rely on VNG test results to diagnose vestibular disorders like BPPV. Why? Because they don't have time to examine you themselves. It's easier to order a test and then read the results at a follow-up visit than to go through a whole vestibular exam. It's just, a lot of times doctors just don't have enough time to test you for all the things the VNG can test. And it is a helpful diagnostic test in a lot of cases. So what is a VNG test? VNG stands for video nystagmography. In other words, this test produces video recordings of nystagmus. Now you may already know, but nystagmus is involuntary eye movement. The VNG is a battery of oculomotor and vestibular tests. Some of the tests are a standard part of a VNG testing protocol. Other tests are optional, and they may be specific to the preferences of the doctor who ordered the test or the clinic that's performing your test. So I've encountered, as I mentioned, some patients who have BPPV, even though they had a normal VNG test. And so that's the question we're seeking to discuss in this video. The first scenario that can occur that can cause a patient to have a normal VNG test, even if they have ear crystals that are loose, is something called type 2 BPPV. Now, if you've watched my other videos in this educational playlist, you've seen my video on the 5 sneaky variants of posterior canal BPPV that they often miss. If you haven't seen that video, that's a great one for you to check out. And this is called type 2 BPPV. For the longest time, I've been calling this symptomatic BPPV. When I took an advanced vestibular course in, I think, 2010, the instructor told us to call it symptomatic BPPV, which is where the testing produces symptoms, but there's no visible eye movement. So there's no nystagmus during the BPPV test. And we still treat it with the same treatments that we would use if they did have eye movement and see if we can resolve it. And it does respond well to treatment. as long as you identify it and you treat it correctly based on symptom patterns in certain BPPV testing positions. Now, these days, people are also calling this subjective BPPV, or the newest term is called type 2 BPPV. So either way, whether you call it symptomatic BPPV, subjective BPPV, or type 2 BPPV, which is the newer term, the bottom line is these are crystals that are loose in the ear and they don't produce eye movement during BPPV testing. And so therefore, this patient will have gotten dizzy or nauseous during the VNG testing portion for BPPV, but they will not have shown any eye movement on the video recording. And therefore, because they don't have any eye movement, so they don't have nystagmus, and therefore it will appear that it's what we call a false negative. So it'll look like the test is negative, but it's false because they have a special type of BPPV that does not show nystagmus, type 2. Okay, so that's one scenario. So typically I'll ask a patient, did you get dizzy during the VNG? And if they say, yeah, I got really dizzy, we'll talk about what portion of the VNG test made them really dizzy. And if it was the part where they're specifically testing for BPPV, that's one clue that maybe they do have that motion activated symptom pattern, dizziness, vertigo, or nausea related to BPPV that just didn't show up with any eye movement on the test. And therefore, their test was said to be negative or clear when really they do have BPPV. So that's one scenario that can cause someone to have a normal VNG test if they have BPPV. And I've talked to a lot of patients that this has happened to, and their doctors have told them, oh, there's no way that you could possibly have BPPV because your VNG test was normal. And so one question is, did you get dizzy during the test when they lied you down or sat you back up? And if the answer is yes, then it's possible you have a type 2 BPPV. Of course, there are other things that can cause that, but that is one of the scenarios. The second possible reason why someone may have BPPV, even though they have a normal VNG test, is that the BPPV could have started after the VNG test was completed. So this is going to be someone who maybe did not get dizzy during the BPPV testing portion of their VNG. So they were tested for BPPV during the VNG test. They did not get dizzy. They did not get nauseous. They did not have any spinning. And so therefore, we can sort of extrapolate from that they probably did not have BPPV at the time of the VNG test. But yet, keep in mind, BPPV can start anytime. So if there's a number of days that have passed between when the VNG test was done and when the doctor is reading or interpreting the results of the VNG, because typically you get the VNG test done and then you have to go back to the doctor for a follow-up appointment for them to look at the test results and decide what to do. If your symptoms have changed between now and then, it's possible you have a new onset of BPPV after the VNG test was already completed. So I've seen that in a number of cases as well, where the patient already was having some problems with dizziness. They went to get a VNG test. They didn't really get dizzy during the BPPV portion of the VNG test, but then the symptoms changed between the date of that test and the date of the follow-up, either with their doctor or with seeing me. And then when I went ahead and tested them for BPPV, sure enough, they did have it. Of course, in most cases, they do have nystagmus. Less common for people to have type 2 BPPV. That's considered a variant. Whereas the classic BPPV, they do present with positional nystagmus that I can observe during my testing. And those are the cases where the symptoms have changed after they got the VNG test, and maybe now I suspect they have a new onset of BPPV that has occurred after the VNG test. And in those cases, of course, I treat them as usual with BPPV treatment maneuvers, and those can be successful. BPPV treatment maneuvers are one of the most clinically valuable treatments available in healthcare today. They work very well in most cases if the assessment is done properly and the treatments are done correctly. In some cases, of course, there's all kinds of variants that can happen when you're looking at treating BPPV. And so There are some times where there are exceptions to these rules, but in most cases, BPPV treatments are very successful with resolving BPPV. Because these scenarios can occur, I always evaluate my patients for BPPV as part of a comprehensive hands-on exam, regardless of their VNG test results. So even if I get a new patient that comes in with a normal VNG, I'm still going to test all of them for BPPV. I certainly review any available VNG test results as part of the comprehensive root cause analysis that I provide to new patients, but I do not solely rely on VNG test results to find the answers. In many cases of dizziness and vertigo, a hands-on exam by a skilled and experienced clinician is superior to diagnostic testing. Diagnostic testing is a valuable means to confirm the physical exam findings and correct diagnosis. But in some cases, if the clinician is entirely relying on diagnostic testing and not conducting a hands-on exam, certain things can fall through the cracks. I hope this video was helpful.